Welcome back, everybody. Now, we're constantly being told that the NHS is at breaking point with 100,000 job vacancies, and now the government's own research has found that 73,000 staff could be sacked in the next couple of months. Why? Well, because they're not fully vaccinated against COVID. NHS workers who have face-to-face contact with patients must have had 2 jabs by April the 1st. But with people needing an 8-week gap between the first and the second dose, staff will be at risk of being sacked as early as February the 4th, which, let's be honest, is just around the corner, isn't it? But can our NHS actually cope? I'm sure loads of people are wondering this. I certainly am. The head of King's College London, for example, says he will lose 10% of his staff. Well, that's one of the largest hospitals in London. I do wonder whether or not people lying there in a hospital bed, needing urgent care, finding the fact that there's no doctors around to treat them, really care whether or not that doctor has actually had the COVID jab. But anyway, to discuss this further, I'm now joined by Dr. Anita Raja, who is a GP in Birmingham. Thank you so much for giving us your time this evening. I really appreciate your insight on this particular topic. If all the unvaccinated staff in the NHS are sacked, will it just crumble to the ground?
Well, first of all, what we've got to understand is that why is this now being mandatory? If we are working as healthcare professionals, it puts a lot of pressure and responsibility on our shoulders. We certainly are not doing a job where we are not coming in contact with people who are not vulnerable and very healthy. The type of people that we see on a daily basis are very frail, unwell, immunocompromised. Hence, this puts an added responsibility on our shoulders. I totally understand the point where you are actually sort of pointing at the staff shortages and saying, do the patients really care whether or not their clinician is vaccinated? It doesn't really count whether the patient cares or not. The thing that counts is that being a healthcare professional, we need to be more responsible. The analogy I usually give, the analogy that I want to give you is in terms of smoking. So you're allowed to smoke as much as you like, wherever you like. But if you're smoking in a room, then that's not okay. A room full of children, that's definitely not okay. So, being vaccinated is very important. And it's nothing new, I don't think. I mean, you will see that there's going to be a shift in terms of the mandate all around the world. Most countries are going to bring this in terms of healthcare professionals, and it will be mandatory.
I think more people would be willing to accept mandatory vaccination for healthcare professionals if this particular coronavirus vaccine actually really stops you getting COVID. Now, I know that it can knock off some of the worst effects. I know that it can reduce transmission. Don't misunderstand me. But the fact is, even if you've had 2 jabs, even if you've had your booster jab, you can still get COVID and pass it on. So really, why are we sacking some of the people who've not had the vaccine?
You're absolutely right when you say this. The COVID vaccine does not stop us from catching COVID, but it certainly stops us from getting critically unwell. Now, you've yourself mentioned that we're suffering from NHS staff shortages. And if we are vaccinated, the chances of us ending up on ITU, if you've had all 3 jabs, go down by 92%. So there's a 92% less chance of us needing hospital admission, being unwell. We can actually get back into work 5 days later. So in all fairness, if we do get vaccinated, we protect ourselves by not getting critically unwell. And number 2, we do not affect the patients that we're coming in contact with adversely.
Absolutely. Now, you gave a very resounding account there of exactly why it's important, in your opinion, for medical professionals, for doctors to have the vaccine. And I understand that. Exactly why, in your opinion, it must be mandated for them. And I understand that. But let's just please talk about the numbers. If 73,000 NHS staff disappear pretty much within the next couple of months, can the NHS cope with that?
It is a very vital question, but then this question that I do want to ask you as well is, do these people actually believe in science? Do they believe in the pandemic? Do they believe in clinical trials? Do they believe in real life data? Are we all on the same page?
Well, okay.
If not,
do you believe that the NHS could survive if 73,000 people went? That's what I'm asking you. I understand. Take your point, but come on now, answer it directly. Do you think that the NHS will survive if 73,000 people disappeared?
I am coming to the answer of your question. The thing is, if you look at the mandate, there is going to be 3 steps to it. So we're not really getting rid of these people. No one is saying that. There is going to be a meeting, and then there's going to be some form of consensus. If we don't reach the consensus, then we're going to look into redeployment. I certainly think that if it comes to safety of patients, we need to be on the same page. We as general practitioners, doctors, healthcare workers, we were never allowed near a patient without the hepatitis B vaccine. This is nothing new. I don't understand why the COVID vaccine all of a sudden has become such a big issue. This has been there for years on end. You were not allowed. I, as a junior doctor, wasn't even asked if I wanted the hepatitis B vaccine. I was simply told I'm not going to be employed if I am not immune and I'm not vaccinated, because I am a risk to other people. So if the question is about NHS and how we're going to cope, then we certainly need to look into employing people who are actually on the same page and are happy to take the responsibility of keeping the vulnerable people safe. And if they're not happy to do that, then that is sad. Yes, it is a crisis. I totally agree with you.
And this is the point, isn't it, really, which is that, OK, all right, people might think it's stupid, people might think it's actively dangerous, frankly, if these people don't get the vaccine. But actually, if the NHS is already short-staffed, 100,000 vacancies, you add 73,000 onto the top of that, look, realistically, you must be able to understand why some people would say, look, screw it, let them work.
No, but the question here is, why are we not able to... I certainly think it's a failure on our part as clinicians or healthcare professionals if we've not been able to convince our counterparts, our colleagues to get vaccinated. I am happy to take that responsibility. And I always tell all my colleagues, because we actively try to spread awareness, that we've not done our job well enough. But I certainly don't think that, we can be allowed to smoke recklessly in a room full of children.
Well, OK, all right. Well, look, Dr Anita, thank you very much. Dr Anita Raja there, of course, GP in Birmingham. Look, I appreciate your time. I appreciate you coming on. I think it's a difficult question to answer, of course it is, but surely if 73,000 more people go, the NHS is going to struggle. But anyway, NHS staff face the sack if they don't have 2 COVID jabs.